Radiation Effects Research Webinar, Radiation and Cancer Risk. These slides provide a basic explanation of the effects of radiation exposure on cancer risk. Health effects of A-bomb radiation exposure can be classified generally into acute radiation symptoms and late effects of radiation. Acute radiation symptoms are considered to be caused by cell death resulting from high-dose exposure. Symptoms such as hair loss, vomiting, and internal bleeding appear a short time after exposure. Unlike acute radiation symptoms, late effects of radiation are considered to be caused by DNA mutations and other changes in cells brought about by exposure. Late effects include leukemia and other cancers that develop several years after radiation exposure. The Radiation Effects Research Foundation investigates long-term effects of A-bomb radiation on the occurrence of cancers and other diseases by monitoring the health status of A-bomb survivors throughout their lives. The Lifespan Study is a research program that forms the basis for determining radiation health effects. The objective of the Lifespan Study is to investigate the effects of radiation on the health of A-bomb survivors over their lifetimes based on an epidemiological study design. Long-term effects of radiation exposure have been investigated by regularly analyzing data obtained in this study concerning cancer rates, as well as deaths from cancers and other causes. The Lifespan Study is comprised of about 120,000 subjects in total, including around 94,000 A-bomb survivors. Subjects were selected from among individuals confirmed in Japan's 1950 national census to have lived in the cities of Hiroshima or Nagasaki. In this study, deaths from cancers and other causes, as well as cancer rates, have been studied since 1950 and 1958, respectively. First, interviews concerning exposure status were conducted with the subjects of the Lifespan Study to estimate the radiation dose to which each individual was exposed. Subsequently, mail questionnaires and other methods were used to obtain information on lifestyle, disease occurrence, and death. How are radiation health effects studied? For the Lifespan Study, investigation into such effects is conducted using a cohort study method. A simple example of the method is the consideration of two groups comprising individuals of similar characteristics in terms of age, sex, and year of birth. One group has been exposed to radiation, and the other group has not been exposed. The health status of each of the individuals in the respective groups is followed to study the occurrence of diseases such as cancer. Cancer rates are calculated to determine the likelihood that the subjects in each of the two groups will develop cancer. The rates of cancers and other diseases are calculated by dividing the number of disease cases by the total follow-up time. Radiation effects on cancer occurrence can be obtained as the ratio of the rates for the two groups. This ratio is called the relative risk of radiation and is calculated in this example to be 1.18. Calculation of the relative risk in this case showed that the cancer rate in the exposed group was 1.18 times higher than the rate in the unexposed group. In other words, the study demonstrates that the cancer rate in the exposed group increased by 18% compared with the rate in the unexposed group. This percentage is called the excess relative risk of radiation. What is the relationship between A-bomb radiation and cancer risk? This slide shows excess relative risk of radiation for occurrence of solid cancers. In other words, cancers excluding leukemia among the Lifespan Study participants. Here, sex averaged risk at age 70 among those exposed at age 30 is estimated for groups classified by radiation dose. Based on these results, cancer risk appears to increase in proportion to dose. In this case, the excess relative risk after exposure to 1 gray of radiation is 0.47, indicating that the cancer risk increases by 47% at that level of exposure. However, what cannot be determined based on these data is whether risk increases from low dose exposure. Let's enlarge this part of the figure. Assuming that the risk is proportional to dose, we would expect risk to increase by 4.7% in the case of exposure to 100 milligray. However, the effects of such low radiation doses cannot be differentiated from variation in the data, making it unclear how exactly the risk increases. It is known that the relative risk of cancer due to radiation among females is slightly higher than among males when comparisons are made at the same dose levels. Cancer risks due to A-bomb radiation are considered to differ substantially not only by radiation dose, but also by age at exposure. At the same dose level as seen here, the lower the age at exposure, the higher the risk tends to be. Relative risk tends to decrease as subjects age with time since exposure. What effects from radiation exposure are there over a lifetime? Here, lifetime cancer risks are estimated as the probability of someone, after a certain age, developing cancer and then dying. The chart indicates the risks of death from cancer among unexposed subjects in the lifespan study population after ages 10, 30, and 50. As a comparison, indicated here are changes in lifetime risks when subjects are exposed to 100 milligray of radiation at each of the same ages. For example, among unexposed subjects, the lifetime probability of death from cancer after age 10 is about 30% in males and 20% in females. With exposure to 100 milligray at age 10, this risk of death from cancer is estimated to increase by about 2% in both males and females. The older an individual is at exposure, the smaller the increase appears to be in lifetime risk of death from cancer due to radiation exposure. Next, let's look at the percentages of diseases associated with radiation exposure. These percentages represent cases caused by radiation. In other words, cases that would not have occurred in the absence of exposure. As shown in this figure, the higher the radiation dose, the higher the percentage is of cases related to exposure. Among all A-bomb survivors, about 11% of the 7,851 cancer cases are considered to be caused by radiation exposure. In the case of leukemia, the percentage of cases considered to be caused by radiation is high, at about 46%. Radiation effects differ substantially depending on cancer site. This slide shows the percentages of cases associated with radiation at sites where cancer rates are increased among A-bomb survivors. The size of the circles indicates a comparison of the number of cancer cases by site among all A-bomb survivors. The red sections within the circles show the percentages of increased cancer cases considered to be caused by radiation exposure. Stomach cancer and lung cancer are frequently observed among A-bomb survivors. The percentages of stomach and lung cancer cases caused by radiation exposure are estimated to be about 10% and 15% respectively. Breast cancer and thyroid cancer are considered to be sensitive to radiation, with the percentages of breast and thyroid cancers caused by radiation exposure estimated to be about 27% and 25% respectively. The effects of A-bomb radiation exposure differ substantially depending on time since exposure. This figure shows how many disease cases developed due to A-bomb radiation exposure by different time periods following exposure. Many acute symptoms developed immediately after exposure. Leukemia started to increase several years after exposure, reaching its peak in 5 to 8 years and decreasing thereafter. Solid cancers started to increase about 10 years after exposure and are considered to be at an excess due to radiation even more than 50 years after exposure. This slide summarizes the information on radiation and cancer risk explained thus far. It is now understood that cancers among A-bomb survivors tend to increase with radiation dose. Cancer risk at age 70 among those exposed to 1 gray at age 30 is estimated to be about 40 to 50% higher than among unexposed people. Lifetime risk of death from cancers increases about 1% among those exposed to 100 milligray at age 30 compared with unexposed people. The lower the age at exposure is, the higher the risk. The risk decreases in relative terms as subjects become older. Effects of radiation on cancer occurrence differ substantially by cancer site. Radiation effects remain even more than 50 years after exposure. It is expected that the effects of radiation on cancer risks will be further clarified by the continued study of A-bomb survivors, including whether there are any differences in the patterns of cancer increase between those exposed at young ages versus those exposed when older, whether there will be any change in the future regarding the occurrence of cancers that have thus far not increased among A-bomb survivors. In addition to radiation, how lifestyle factors, such as smoking and diet, affect cancer occurrence. How radiation exposure causes cancer. Genetic factors that are related to individual differences in sensitivity to diseases and radiation health effects. We expect to be able to answer these questions at some point in the future. This marks the conclusion of the Radiation Effects Research webinar titled Radiation and Cancer Risk. Thank you for your attention.